Okay, here's a hoof that's been removed from the rest of the limb. And what I want to point out here is the bulk of this hoof wall, that's our stratum medium. So there's the top of it right up here in that coronary groove. Stratum medium is the bulk of the hoof wall. The stratum externum or the periopal would have been this dried out, what we were calling a shellacked kind of area on this thing, waterproof in the stratum medium. So you really don't see it, you're looking through it at the stratum medium there, the bulk of that hoof wall. So stratum externum here. The stratum internum are all of those little layers, little lamina on the inside of that stratum medium. Here's a specimen of the distal limb of a horse, kind of in cross section. And what this is demonstrating is what we have here is the distal end of the cannon bone. Here's P1. Here is a proximal sesamoid bone embedded within the interosseous muscle right here. If we come on down the limb, here's P2, here's P3, and there's our navicular bone. And this white that you see at the end of the bones, that's actually articular cartilage showing there. So distal interphalangeal joint here, proximal interphalangeal joint there, metacarpophalangeal joint there, same thing as the fetlock joint. The structure here is the interosseous muscle coming down. It has the proximal sesamoid embedded within it. Here come those distal sesamoidean ligaments here on down the limb off of the end of our proximal sesamoid bone. This little piece in here that inserts from the proximal sesamoid to the very proximal end palmar side of P1, that's the cruciate sesamoidean ligament. The oblique sesamoidean ligament's the next one closer to the surface of the animal. It comes down and it attaches along the back side of P1 down to here. And the one more superficial than that will be this region back here. And there's our straight sesamoidean ligament coming down, passing up P1 to come down to attach to P2. So there are our three sesamoidean ligaments, the straight, the oblique, and the cruciate. Now behind that, what we have, this is our DDF tendon here. This is the SDF tendon here. It's already getting thin. This is where the DDF is passing through that flexor manica of the SDF. The DDF comes on down the limb to attach here to P3. The SDF is slipping off around the side and disappearing from our midline section because it needs to attach to the medial and lateral aspects of P2 as it reaches the distal end of this foot of the horse. The extensor tendon on this limb, it's a forelimb. It'll be our commendigial extensor. It doesn't show up too well up here. We've got some thick skin over this, but it's running right down through here. As it comes down, you kind of pick it up right here and you can see it come down and insert nicely on the extensor process of P3 at that location there. Other things that we can see in this cross section here, if we come down to the hoof, he's got some problems here. It's not a nicely taken care of foot. But what we can see here on our navicular bone, the suspensory ligament of the navicular bone will be this tissue at the proximal end of it. We have it drawn in your notes. You only get that on a cross section because it's going to swing off laterally to attach higher up the limb. Distal ligament of the navicular bone, you can see it nicely right there attaching the navicular bone down here to P3. The navicular bursa sits right here between the navicular bone and the tendon of the deep digital flexor muscle right here. So the navicular bursa is a space you're seeing right there. This big white area here, this is our digital cushion. When we start talking about the dermises here, the dermis of the skin is sitting here, and when you come down, we get to the top of our hoof, and the coronary groove would have been this place here. It's not as concave as it should be because he's got some abnormal hoof growth, but the coronary dermis or coronary corium is sitting right in here. The periopic dermis would be a little bit higher up, producing the periopal right here. That would show better on a wet specimen. And once this coronary dermis comes down to this point here and starts, the dermis runs down between the hoof wall and P3. This is our laminar dermis here. When you flip up underneath P3, this is the dermis of the sole, because I'm over the sole here. And when you get farther back, it will be dermis of the frog, where you're sitting over the frog. And if you were to lift this up, again, not a very well taken care of hoof. Here's the frog back here. Here is the sole up here. So the dermis is just named for what structure it's laying above. Here's a well-trimmed horse hoof. And what you can see here is the hoof wall where it contacts the ground, toe, this region here, quarters down the side, heels, this portion back here, and then the bar is where it reflects back dorsally. So back into the heel, and here comes the bar right back there. There's the bars. Here's our frog here. The peritoneal groove is here on either side of that frog. There and there. And then this flat surface out here, this is the sole. So here is that heel coming down here. Here's the bar coming up right along the outside of that peritoneal groove, and our triangular shaped frog back here. Bulbs of the heels would be these regions back up here as you're kind of running proximal back up that limb. We're just seeing the bottoms of them there.